My name is Patricia Lambert, Patricia Lambert. I'm in faculty. I'm on the faculty of the Master's Program in Public Health, and I teach HM 836, which is Global Comparative Healthcare Systems. Well, it's fun. We actually, the students look at about 21 countries and look at the kinds of healthcare system that they have there, and then they analyze that particular healthcare system, but they analyze it within a cultural context, because a lot of our beliefs and our traditions and our values kind of play out in health and healthcare. And then they compare at least 2 or 3 of the countries to see what similarities and what differences there are. So it's a challenging class, but it's fun. Okay, well, you look at a country like Japan, for example. It's a smaller country, first of all, but they're very homogenous. And they share a lot of the same beliefs and traditions. But one of their beliefs is that healthcare is something that should be provided to everyone. And so, unlike the US, where we're having a difficult time struggling with a new healthcare bill that says, yes, those other, 40 million Americans should have access to healthcare. So we look at the healthcare system within cost, quality, access, and then what kind of cultural beliefs help them fashion the way that they provide healthcare. Interesting. I think I've heard several of them say that you can take one healthcare system and put it in another country, and it doesn't look quite the same. And but when you think about it, for example, the healthcare that's offered in California is sometimes not the same as that's offered in Alabama or New York or North Dakota. You know, there are varieties, and those varieties are based on the fact of not only the kinds of health problems, but what people consider most important in health and healthcare. So it's always kind of a regional take on a system that might be transferable to another country, but it's a little different. Not so much background as, and they really don't need a lot of background in healthcare, but they have to really enjoy learning about different cultures, because sometimes that can be, it's bothersome sometimes. I gave an example one time of, I actually had students in Japan, and then I had them in Ireland. And in Ireland, it bothered them so much because we went to the maternity hospital, and they said, well, there are pregnant women over there smoking. Well, yes, and we used to do that in the United States too. But you have to put that in the context of, if allowing them to do that helps them to show up for their appointments, it's more important that they come to the appointment, and then you work on other things. And in Japan, it was, being able to walk in and get health care anywhere and not having to prove your insurance or anything else. It was just there and provided for you. So those things were surprising. Absolutely. We get used to our own systems. Okay, I have taught online a lot in the last 10 years or so, and sometimes you get to know people even more than you would when you talk to them, but you get to know them in a different way. You get to know about them. But at the beginning of the course, I always start out by calling each student, and it's funny, their reaction. First of all, because we don't use phones that much anymore either, when you think about our culture. And so this semester I was calling students, and they almost all started out with, am I in trouble? Did I do something wrong? Why are you calling? Just to talk. Want to tell you a little bit about myself. And it's one thing when you put it in writing in a course, but it's another thing when we can sit down and kind of you know, exchange some ideas and play off each other's conversation. So it's a good experience. So I always try and think of more interactive things to do in the course. I like to have videos and some things that make it more interesting. So one of the things I'm trying to do is to do a lot more interviews with healthcare providers from different countries, so that I can put it in the course and they can hear from somebody who's actually from there, from the country. I've done a couple of them. I actually did one by Skype with someone from the UK, and I'm in the process of interviewing somebody from Zimbabwe, somebody from Brazil. Where's the other one? India. So it'll be fun. With them. But since we don't do that here, it's even more of a challenge. And I mean, I've had students say, I feel like I graduated from my computer. You know, they don't get the sense of MSU, and that's another thing. And this is an idea from another faculty I worked with. She used to start out every week with a video someplace on campus. And she'd be standing in front of Sparty, you know, here's Sparty, let me tell you a little bit about Sparty, you know, and she would go through that. Or she would say, now here's my office, this is where I, you know, have class with you, or Breslin, and that's a great idea. But I didn't have time to do that, so, but it is a good idea, because then they get connected with MSU. Otherwise, you don't feel like it's you're an alum from there. Well, and some of that has to do with the way that you structure the course, and I structure it by week, so that you can't wait till week 4 and try to get caught up. And if somebody misses out on a week, then I do contact them. But then they finish 1 week at a time, and it makes it easier to be engaged in the course. And I ask them to, you know, arrange their schedule so that if they're going to take this course, they should have this block of time scheduled so many times a week. And but then you have to actually sit down and get into the course. And that takes a lot of self-discipline. But you don't make it without it. I mean, the 3rd week into the course, I think most of our courses are arranged that way. And you're so lost by that time, and you don't know any of your classmates, and if there are discussion groups, you've missed those. I have them work in partners with some of the things so that they can kind of learn from each other too. But it's much more than you would do in a classroom in terms of being connected to other people. It's just not the face-to-face contact. And the way technology is improving, we'll be able to sit around the living room with each other if we want to and never be there. So, but it is a lot of self-discipline. And these students are, I'll tell you, they're motivated. And with a graduate program, so many of them work that they know what they want, they're focused, and they know that this is going to help them in their professional life. So once they've made up their mind about that, it's usually very direct.